Jazz. We've all heard the old saying that the eyes are the windows to the soul. But in the world of medicine, especially as we cross that 60-year-old threshold, your eyes are something much more practical. Jazz. They are the early warning system for your heart, your brain, and your blood vessels. Most of us ignore the small things. We see stars when we stand up too fast and think it's just a head rush. Jazz. We notice our vision blurring for a second during a morning walk and blame it on the light. But today, Jazz, I want to show you why those eye signs are actually your body's way of shouting for help before a perfect storm hits. Jazz. I'm going to share a story with you that most doctors don't have the time to tell in a 10-minute appointment. It's a story about a cardiologist, a man who had performed over 2,400 procedures. And yet, Jazz, he almost lost his own father because he dismissed a simple morning symptom. Before we go further, let me be honest with you. This isn't just a video about health tips. This is about survival. Jazz. If you are over 60, or you love someone who is, what you're about to learn could be the difference between a normal Tuesday and an emergency room visit. Jazz. We're going to look at the warning signs hiding in your eyes, your morning routine, and even your bathroom habits. And I'm going to give you the exact protocols to fix them. Jazz. The warning in the stars, orthostatic hypertension. Let's start with that moment I mentioned. Seeing stars. You're lying in bed, the alarm goes off, and you jump out to start your day. Jazz. For a split second, your vision swims. You see those little flickering lights, and you might feel a bit wobbly. In medicine, we call this orthostatic hypotension. Jazz. But here is what is actually happening. When you've been lying flat for 8 hours, your blood is evenly distributed. The moment you stand up abruptly, Jazz, gravity pulls up to 1 full liter of blood down into your legs and abdomen. In a younger person, pressure sensors called baroreceptors catch this instantly and tell the heart to pump harder. Jazz. But as we age, those sensors become like smoke detectors with dying batteries. There's a lag. During that lag, your brain and your eyes are literally starving for oxygen. Jazz. Those stars are the final distress signal of a brain that isn't getting the blood flow it needs. This isn't just a dizzy spell. It's a cardiovascular bomb. Jazz. When your body finally realizes what's happening, it panics. It releases a massive surge of adrenaline to jack your blood pressure back up, forcing your heart to rev from idle to maximum RPM in seconds. Jazz. For a heart that has been beating for 70 or 80 years, this sudden violent acceleration can trigger fatal arrhythmias. The eye connection. Jazz. If you frequently see stars or experience blurred vision upon standing, your cardiovascular system is telling you it can no longer handle abrupt changes. The drifting gaze. Jazz. Your cerebellum and the neck now. Let's talk about a different kind of visual warning. Have you noticed that you can't walk straight like you used to? Maybe you drift to one side in a hallway. Jazz. Or you find yourself reaching for the wall just to steady your gaze. Most people think the problem is in their legs. They do more squats or walk more miles, but nothing changes. The truth is, Jazz, the problem might be in your neck. At the base of your skull sits the cerebellum, your brain's balance command center. It relies on a constant stream of information from your muscles, your joints, Jazz, and most importantly, your eyes. When you walk, your cerebellum uses your vision to make tiny corrections that keep you upright. But here's the real fix no one tells you. Jazz. The arteries that feed your cerebellum travel through the bones of your neck. After years of poor posture or stiffness, those neck muscles can become so tight they quietly compress those arteries. Jazz. Your cerebellum starts running on reduced power. The eye connection. If you find it hard to keep your eyes locked on a fixed point while turning, Jazz. Or if your vision feels disconnected from your movement, It's a sign that the blood supply to your balance center is being restricted by the tension in your neck. Gas. The hidden warning signs of the internal river. Sometimes the warning signs aren't visual at all. They are neighborly. I want to talk about something uncomfortable but vital. Your gut health, specifically. What happens when things get stuck? Imagine your colon as a long, winding river. As we age, that river slows down. Dehydration, medications like blood pressure pills, gas, and reduced mobility can turn your waste into a dense, solid mass called fecal impaction. But here is the warning sign that sends people to the ER for the wrong reason. Bladder pressure, gas. Your rectum and your bladder are neighbors. When the rectum is packed with a hardened mass, it physically pushes against the bladder, gas. I've had patients come in convinced they had a bladder infection because they felt a constant need to go, but could only pass a few drops. In reality, gas. Their gut was so blocked it was crushing their urinary system. Even more confusing is overflow incontinence. You might think you have diarrhea because liquid waste is seeping around a hard blockage, gas. If you take anti-diarrheal medication in this moment, you are making a dangerous mistake. You are essentially cementing that blockage in place. Gas. The morning detonation. I want to go back to Dr. Jason Ford's father. He was a man who did everything right through, or so he thought. He stayed active, he retired, and he followed a strict morning routine. Gas. But that routine was a ticking time bomb. When you wake up, your body doesn't turn on like a light switch. It detonates. Within 15 minutes, your cortisol levels spike by 60%. Gas. Your blood pressure shoots up by 20 points. And because you haven't had water for 8 hours, your blood is thick and viscous, like honey instead of water. Gas. Dr. Ford's father was making one of the 5 deadly morning mistakes. Extreme cold exposure. He would jump out of bed and take an ice-cold shower, thinking he was biohacking his way to longevity. Gas. But for a senior, that cold shock causes massive peripheral vasoconstriction. Thousands of small blood vessels slam shut simultaneously. The pressure in your remaining open vessels explodes. Gas. For an aging heart, this is like trying to inflate an old, dried-out balloon too fast. The risk of rupture or cardiac arrest is catastrophic. The medication glitches. Amlodipine, lisinopril, gas, and losartan. Many of you watching this are likely taking something for your blood pressure. These are powerful drugs, but they often come with signals that seniors are taught to ignore. Gas. Take amlodipine. It's a calcium channel blocker that relaxes your arteries, but sometimes it relaxes the arteries in your legs, so much that blood flows in faster than the veins can carry it back out. Gas. The result? Puffy ankles and socks that leave deep marks. This isn't heart failure. It's the drug doing its job a little too well. Then there's lisinopril, an ACE inhibitor. It can cause a dry, gas, relentless tickle in the back of your throat. People often blame allergies or dust, but it's actually the medication. However, if you notice your lips or tongue swelling, gas, that is not a nuisance. That is a medical emergency called angioedema. Finally, there is losartan. If you've switched to heart-healthy salt substitutes while on this drug, you might be in trouble. Gas. Those substitutes often replace sodium with potassium. Since losartan already raises your potassium levels, you could be accidentally overloading your system, gas, which can affect the electrical rhythm of your heart. The solution. The 5-minute morning protocol. So, what do we do? How do we stop these warning signs from becoming tragedies? Gas. It starts with the first 5 minutes of your day. This is the protocol that Dr. Ford's father now follows religiously. Step 1. The awakening minute. When the alarm goes off, stay lying down. Gas. Resist the urge to jump up. Breathe deeply, in for 4 seconds, hold for 4, and exhale for 6. This sends a signal to your nervous system that there is no emergency. Step 2. The hydration minute. Gas. Keep a glass of room temperature water on your nightstand. Sit up slowly, let your feet rest onto the floor for 60 seconds, and drink the entire glass. Gas. This dilutes your thick morning blood and reduces the risk of clots and heart attacks. Step 3. Move slowly. Only after those 2 minutes should you stand up. Gas. This gives your slow baroreceptors time to adjust, preventing that seeing stars oxygen deprivation in the brain. The 12-minute balance routine if you've been drifting or reaching for walls. Gas. You need to rebond the pathway to your cerebellum. You can do this in less than 12 minutes a day with 8 simple exercises. Group 1. Neck release. Morning base of neck rotation. Gas. Gently rotate your head while applying light pressure to the bony bump at the base of your neck. Side neck stretch. Gas. Anchor your collarbone and tilt your head to the opposite side to release the muscles pressing on your arteries. Self-massage. Gas. Use your fingertips to soften the tissue from the base of your skull down to your shoulders. Group 2. Cerebellum training. Anytime. Slow motion walk. Walk so slowly that each step takes 4 seconds. Gas. This strips away momentum and forces your brain to relearn balance. Tandem heel-toe walk. Walk as if you're on a tightrope. This trains you for narrow hallways and tight spaces. Gas. Standing marches with crossbody tap. Lift your right knee and tap it with your left hand. This crosstalk between brain hemispheres is essential for coordinated walking. Fax point turn. Gas. Find a mark on the wall and keep your eyes locked on it while you slowly turn 360 degrees. This forces your eyes and inner ear to coordinate. Multi-direction weight shifts. Shift your weight right, gas, left, forward and back while holding onto a sturdy chair. A note on long-term prevention before I go. I want to address those of you who have struggled with your internal river. Gas. Prevention isn't about expensive supplements. It's about the 4 pillars. Hydration, 6 to 8 glasses of water a day. Movement, a 20-minute daily walk. Fiber, gas. Soluble fiber from oats and cooked vegetables. Scheduled time. Sit on the toilet 30 to 60 minutes after breakfast to work with your body's natural rhythm. And please, gas. If you are on blood pressure medication, have a sick day plan. If you get a stomach bug or become dehydrated, your normal dose can suddenly become toxic to your kidneys. Ask your doctor, gas. What should I do with my pills if I can't keep fluids down?